Hello and welcome to your monthly update from COVIDENCE UK study. My name's Adrian Martineau. I'm the Chief Investigator based here at Queen Mary, University of London. And with us today is Giulia Vivaldi, our lead statistician, who's going to give us an update on the webinar she presented last month. Now, that talk focused on the impact of delay since vaccination on severity of COVID-19 among all participants. But what Giulia's going to focus on today is the subset of people who have asthma. So without further ado, I'll hand over to you, Giulia.
Thanks, Adrian. So in last month's webinar, we looked at whether time since vaccination affected the severity and duration of COVID-19 symptoms in a boosted population, with a particular focus on different age groups. In today's webinar, we're going to look specifically at people with asthma and consider whether time since last vaccination affects their infection severity, but also their likelihood of experiencing an asthma exacerbation. So when considering boosters, vaccine eligibility for people with asthma depends on how well their asthma is controlled. The JCVI currently recommends that people with poorly controlled asthma receive a yearly booster in the autumn. And they define poorly controlled according to the types of medications that people take to control their asthma and the frequency and severity of their exacerbations. So people who are not taking these medications or not experiencing exacerbations would be considered to have well-controlled asthma and so wouldn't be eligible for an annual booster, although they may be eligible because of their age or other health conditions. So why do we want to focus on people with asthma? People with poorly controlled asthma are believed to be at increased risk of severe COVID, and this is why they're offered annual vaccinations. But the acute infection isn't necessarily the only problem for asthmatics. Acute respiratory infections, like COVID-19, are known to trigger asthma exacerbations, something that we have previously shown in a COVIDENCE UK analysis. What we don't know is whether this association between COVID-19 and asthma exacerbations continues to exist in a heavily vaccinated population, and whether the risk changes according to how recently you've been vaccinated. So there were two groups of outcomes for this analysis. First, we looked at whether time since vaccination was related to infection severity for people who had COVID. And to do this, we looked at three elements of the infection: self-reported symptom severity, symptom duration, and changes to health-related quality of life. Then we looked at whether getting COVID-19 was associated with having an asthma exacerbation in that same month, and whether time since vaccination in those cases made a difference. And we looked separately at severe exacerbations, which would require medical treatment or a visit to the hospital. We looked at these outcomes in 2,100 participants with asthma who had received at least one booster vaccine. 60% of these participants were in the respiratory risk group, meaning that they either had poorly controlled asthma or they also had COPD. And 60% of these participants reported COVID-19 at least once over follow-up, whereas 41% reported at least one asthma exacerbation over follow-up. And as in the previous webinar, we adjusted for factors that we believed were associated with both time since vaccination and COVID-19 severity, while also adjusting for asthma severity and exacerbation history in our exacerbation analysis. For symptom severity, we looked at the odds of reporting being very unwell, which means being unable to do all usual activities and having to go to bed during the day. For people with controlled asthma who are currently not offered annual boosters, we looked at the effect of annual vaccination, whereas for people in the respiratory risk group who are already eligible for annual boosters, we looked at the effect of increasing this offering to a booster vaccine every 6 months. Our findings suggest that in both groups, being vaccinated less frequently might be associated with reporting being very unwell. However, because of a small sample size, it's hard to know this conclusively. As you can see, in both cases, our odds ratios cross 1. When we looked at symptom duration and health-related quality of life after infection, as measured with the EQ5D, we did not find any significant differences according to time since vaccination. We note again that we have a small sample size, but this is similar to the results that we observed in other groups as well. When looking at risk of asthma exacerbations, we were interested in seeing whether having COVID-19 when fully vaccinated was still associated with increased risk of an exacerbation, and whether this association changed according to how long ago someone had been vaccinated. So our reference group in this analysis are people who are not currently reporting an infection. And we found that incident COVID-19 continued to be associated with an increased risk of asthma exacerbation, both when vaccinated less than 12 months earlier and when vaccinated more than 12 months earlier. For any type of asthma exacerbation, the point estimates were quite similar, roughly 5 times higher in people vaccinated within the past year, and roughly 6 times higher in people vaccinated more than 1 year ago. For severe asthma exacerbations, the point estimates were quite different. Odds of severe exacerbations were roughly 7 times higher in people with COVID who had been vaccinated in the past year, and more than 10 times higher in people with COVID who had been vaccinated more than 1 year ago. However, as you can see by the confidence intervals for these estimates, this difference between the estimates was not significant. So how should we interpret these results? We can conclude that more recent vaccination is associated with a reduced likelihood of feeling very unwell during COVID-19 among people with asthma, but we found no association with other measures of COVID-19 severity, such as symptom duration and health-related quality of life. Incident COVID was still associated with an increased risk of asthma exacerbations despite booster vaccinations. And our findings suggest that risk of severe exacerbations might increase when people are vaccinated more than 1 year ago, but we were unable to show a significant difference, and this could be because we didn't have enough data. So the next thing that needs to be done is to repeat these analyses in another larger population with asthma. This is the only way that we can find out whether the potential difference that we observed is actually there and how big it is. In particular, it's also important to look at people with well-controlled asthma, as they are not currently offered booster vaccinations. Our numbers were too small to look at them specifically in our exacerbations analysis.
Well, thank you very much, Giulia, for that typically lucid presentation. Extra evidence, if needed, that it's definitely worth getting your COVID jab when it's been offered, whether or not you have asthma. I think also the data go to highlight the importance of everyone's contribution towards completing the questionnaires long after the pandemic has finished. That gives us these really valuable longitudinal data which look at the value of the vaccination programme long after the acute pandemic. So thank you, Giulia. Thank you to everyone who has participated. And unfortunately, I have some sad news, which is this will be Giulia's last webinar with us. And I just want to thank you, Giulia, on behalf of all the COVIDENCE team, and I'm sure all our participants, for your outstanding work on the study. I'm really grateful.
Thanks very much, Adrian. I really want to thank the participants, because without their selfless contributions, this research wouldn't be possible. So they really make all the difference.
I can only agree. So from all of us, goodbye, and I'll see you next month.